Welcome to another episode of JEiiNCLUSIVE. Please share, like, comment, subscribe, and set your notifications on so you are alerted every time I upload. Sunday was World AIDS Day.
Together, we honor the spirit of resilience and the extraordinary strength of people, families, and communities affected by HIV/AIDS, including nearly 40 million people living with HIV around the world today, 40 million. And we send a clear message to the nation and to the world that we stand united in the fight against this epidemic. It matters. It matters we reinstate that. I remember as senator when this epidemic was raging, the stigma, the misinformation, the government failing to act and acknowledge the dignity of lgbtqia plus lives and the seriousness of the AIDS epidemic. It caused serious harm. It compounded pain and trauma for a community watching a generational...
So let's travel back in time for a little history before spinning the block back to 2024 to see how far we have come, how far we have to go, as well as address some concerns I have heard from some of my positive friends and associates over the years. 1981, Ronald Reagan was sworn in as the 40th President of the United States, and within a few months into his term, he was wounded in an assassination attempt. That same year, the first microcomputer from IBM, the 5150, made its debut. Diana Ross and Lionel Richie also released Billboard's Song of the Year with Endless Love, and the groundbreaking network, the first of its kind, MTV, premiered to define a generation. 1981 would also be the year where the first cases of what would later be called AIDS were silently being reported in the United States. Rare infections like pneumocystis pneumonia and Kaposi sarcoma were appearing rapidly among young gay men in Los Angeles and New York, and at the time, doctors referred to the disease as GRID, short for gay-related immune deficiency, or the gay disease.
A mystery disease known as the gay plague has become an epidemic unprecedented in the history of American medicine. That today from the Center for Disease Control in Atlanta. Topping the list of likely victims are male homosexuals who have many partners and drug users who inject themselves with needles. Medical experts say the disease kills 4 out of every 10 people it strikes and that it threatens to explode in the nation's cities.
The following year, the term AIDS, acquired immune deficiency syndrome, was coined. And through further research, it was discovered that sex was not the only way in which this new virus was being spread. People who used injection drugs and blood transfusion recipients were also becoming victims of this new disease. It wasn't until 1983, 1984, when scientists identified HIV, human immunodeficiency virus, as the causative agent of AIDS, and research definitively pinpointed sexual contact, blood, and vertical transmission, mother to child, as primary transmission modes. In 1985, the first HIV antibody test was approved, allowing for blood screening and diagnosis, and as public awareness of the virus began to spread, so did fear and stigma.
Here at home, the dramatic hearings concerning a child with AIDS attending school in Queens continue. The protests seem to be quieting down, but there was a lot of confusion today about a surprising statement by that child's lawyer yesterday. Barbara Laskin reports.
I don't want any of you to assume that my client has AIDS. We'll come to that later.
Again today, there was more doubt cast as to whether or not the plaintiff in this case has AIDS. On the witness stand, Dr. Ari Rubenstein, a renowned figure in AIDS treatment, who said he knew of no child with AIDS who had ever shown improvement after being diagnosed. This seems to contradict the findings of the city's special panel, which allowed an AIDS child to continue at school because that child had shown improvement. Under state law, AIDS is not considered a communicable disease. It must, however, be reported to authorities, and that can be kept confidential. It's expected that Judge Hyman will rule on that very issue of whether or not the disease is communicable and whether or not the child who has it should be isolated.
People with HIV face discrimination from family, friends, and institutions, including being kicked out of homes, losing their jobs, and even being avoided by medical professionals. In the early 1980s, AIDS was initially perceived as a white gay disease, affecting primarily white gay and bisexual men. Unfortunately, this perception overshadowed the needs of ethnic minorities, leading to a lack of outreach and early treatment options for Black and brown people. By the mid-'80s, the CDC observed that African Americans faced a disproportionate AIDS diagnosis rate. This spurred Black activists to advocate for more inclusive AIDS campaigns and initiatives. Parallelly, Black, gay, and lesbian communities launched campaigns emphasizing AIDS' non-discriminatory nature. By the end of the decade, which saw a lot of prosperity in certain privileged groups, An estimated 100,777 people had died from AIDS in the United States, with the disease ranking as the 10th leading cause of death for African Americans and the 3rd leading cause for African American men. But by the end of 1990, AIDS had grown to be the 6th leading cause of death for all African Americans. HIV-related mortality rates, deaths with HIV noted as the underlying cause of death, peaked in 1995 with over 50,000 people having succumbed to AIDS-related deaths. So fast forward to 2024, and African Americans continue to be disproportionately affected by the HIV/AIDS epidemic, accounting for approximately 44% of all new HIV diagnoses in the United States, despite making up only 12% of the population. In 2023, an estimated 23,000 African Americans were diagnosed with HIV, with young gay Black men under the age of 25 living in southern states, leading in those new diagnoses. In 2024, an estimated 1 in 48 African Americans living with HIV are unaware of their status, highlighting the need for increased testing and awareness efforts in Black communities. So you're positive. When your initial test comes back positive, unless you've done the at-home test, you should be offered a confirmatory test, basically a second test to make sure you're HIV positive. The likelihood of 2 false positives is extremely rare. If you take an at-home test, it's a good idea to go to a doctor or clinic to do a second test. Sadly, false negative test results can happen too. So if you come up positive and your partner comes up negative, be cautious and have your partner retest. According to AIDS.gov, the likelihood of a false negative depends on when you might have been exposed to HIV and when you took the test. It takes time for seroconversion to occur. This is when your body begins to produce the antibodies an HIV test is looking for, anywhere from 2 weeks to 6 months after infection. So if you have an HIV test with a negative result within 3 months of your last possible exposure to HIV, the CDC recommends that you be retested 3 months after that first screening test. A negative result is only accurate if you haven't had any risks for HIV infection in the last 6 months, and a negative result is only good for past exposure. Does being HIV positive mean you also have AIDS? Absolutely not. In the U.S., the majority of people living with HIV will never develop AIDS, which is the most advanced stage of the HIV disease. HIV is the virus that causes AIDS. But for most people, proper treatment and regular medical care to keep your immune system strong will prevent you from ever developing AIDS. Remember, an HIV-positive test result means only that you have HIV. What will change for you in your everyday life now that you are positive? With proper treatment, being HIV positive is a manageable chronic condition like lupus, diabetes, or asthma. But it's a chronic condition nonetheless. Unless you had other health conditions prior to diagnosis, you'll likely see a physician more than you did before because it's vital that you monitor your health closely. Regular visits with your HIV healthcare provider will help keep you up to date on everything concerning your health. Speak with your doctor openly about changes that need to be made to your diet, exercise regimen, and use of alcohol, prescription medicines, and recreational drugs. If drugs were a factor in your transmission, there's a link between crystal meth use and HIV transmission, for example. Your doctor might recommend rehab. You may tire more easily, be more prone to infections, have medical side effects that you didn't have before. But hands down, the biggest change in your daily routine will be taking medication. HIV medication requires strict adherence to the prescribed daily dosage, and the drugs often have side effects. One good thing is, once you reach undetectable status, you may be eligible for an injectable HIV treatment that can be administered every 2 months. Whatever you decide, open communication with your doctor will ensure that you are fully equipped to handle the changes in your life. Does this mean you have to stop having sex? No, not unless you want to, but I encourage you not to stop. Orgasms can be wonder drugs in themselves. They help you sleep, boost your immunoglobulin levels, which fight infections, and reduce stress, loneliness, and depression. There are ways to protect yourself and your partner, including consistent condom use, PrEP, Sera sorting, and keeping your viral load undetectable. One tip, if you use lube during anal sex, avoid 2 ingredients, Polyquaternium and polyquaternium 15, both types of polymers, may increase the possibility of HIV transmission. What about oral sex? It is far less common, but it is possible to transmit HIV through oral sex. If you have HIV and your partner performs, on you, but you do not release in that person's mouth, you have an extremely low chance of passing HIV to them. When ejaculation occurs during fellatio, the risk of HIV transmission rises. Researchers debate what the rate of transmission is, but most estimates are between 1 and 10%. But you lower that to almost no risk if you pull out for the money shot. What is PrEP? PrEP is a once-daily pill regimen that is 99% effective at preventing HIV. It's taken daily to prevent infection and has been approved for use in anyone at high risk. Your partner would be considered high risk now that you are positive. PrEP is extremely effective when taken correctly, but doctors still recommend you use condoms for added protection. And make no mistake here, if you are positive, your partner cannot just take your Truvada if that's what you're prescribed. There is a difference in the combination between the formulation, and if you're positive, your medication will not work for your negative partner, and it could actually do your negative partner great harm. What is a serodiscordant couple? Serodiscordant simply means one of you has HIV and one of you doesn't. Some gay couples use the term magnetic couples to mean the same thing. There's very little research on how successfully serodiscordant or mixed couples cope with the complications of HIV. So how do you handle being in a serodiscordant relationship? What you need to know if you're a mixed couple is that you can have a happy and healthy relationship. But like all relationships, couples might also want to see a counselor who specializes in coping with HIV. Many HIV-positive people fear spreading the disease to their partners, making sex fraught with tension. A counselor can help you work through those kinds of issues and communicate to each other your anxieties, fears, and needs. Can you still have children? Yes. If you're a woman who is positive, medications can make it so you have less than a 1% chance of transmitting HIV to your unborn child. If you're a man, your sperm will need to be washed of HIV and then inseminated into your partner, wife, or surrogate. The main difference for couples is that you'll need a specialist who deals with HIV, fertility, and insemination. PrEP has also recently been prescribed by doctors off-label to prevent transmission during intercourse when couples are trying to conceive as well. If you want to adopt or foster parent, there are some new protections for HIV-positive parents-to-be that ensure you can't be discriminated against. Transgender individuals, especially transgender women, face alarming rates of HIV, with 62% of Black and 35% of Hispanic Latina transgender women testing positive. These health disparities are compounded by socioeconomic challenges. Nearly 2/3 live at or below the poverty line, and many experience homelessness. Stigma, discrimination, and systemic racism further isolate transgender people, particularly those of color, limiting their access to critical medical services like PrEP and consistent HIV care. The impact of negative treatment on adherence to HIV care underscores the urgent need for inclusive healthcare environments. In Atlanta, specialists like Dr. Aaron Everett provide essential services, including HIV and hormone replacement therapy, but finding comparable care in smaller cities can be difficult. However, resources are available, and continued research is crucial. You never know what support might be out there. The most important thing to remember is that you did nothing wrong. No one deserves health complications. And if you are HIV positive, all that means is that you put trust in someone, and whether knowingly or unknowingly, that person betrayed your trust. Although we have a long way to go with making sure everyone receives the HIV treatment they need, we've also come a long way where you can live a normal, healthy, and fulfilling life.
John Ferreira, Phil Harrington.
At sunrise this morning, they began their tribute to people who died of AIDS. The task of reading out their names, often more than their friends could cope with.
Jose Sal's.
From all over the country, the families and friends of the victims had gathered to watch the unveiling of a huge quilt the size of a football field. Each panel bore the name of an AIDS victim. Often groups had made the panels, trying to catch something of the spirit of their lost friends in the design. When it was done and laid out in front of the Capitol building, the quilt was, as it were, lying at the feet of the American Congress. The government here is much criticized by the gay community for not doing enough to educate people about AIDS. Congressman Jerry Studs was among those taking part.
This administration absolutely refuses to engage in serious, widespread national public education. That, in my judgment, using words very deliberately, very calmly, is criminally negligent.
There were 2,600 names in all, each one a story of personal tragedy. Mike Trummer spread his dead lover's ashes on the panel bearing his name. Elsie Cohen lost her son to AIDS just a month ago.
He was just a wonderful son.
This afternoon, AIDS sufferers led a march past the White House, organizers estimating that 100,000 people took part. Ken Reese, ITN, Washington.
And you owe it to your friends, family, all those who succumb to the disease, and most importantly, yourself, to continue fighting for life.